viewers, and welcome to another edition of Drill Kopa. Do you know that the burning sensation you feel in your heart is not ulcer? Do you also know that the stomach abdominal pain you feel is not ulcer? Do you also know that hunger does not cause ulcer? Today on the edition of Drill Kopa, we will be talking about a very important and vital topic, which is peptic disease. Peptic disease is ulcer, whereby people often mistake it for a hard burning chest, or maybe sometimes they mistake it for an abdominal pain or a vomiting, or sometimes you hear people saying, I didn't eat today, I'm going to get ulcer. I'll tell you what, today in the studio we will be discussing about this peptic ulcer, and we'll be going to dive into it, and we'll discuss the causes, the types, and what it really is. I am Juliana Pius Bema, and with me today in the studio is...
Hello, I'm Dr. Sadiq Muhammad Habib.
And...
I'm Emilus Mohammed Hamza.
I'm Dr. Fatima Baffa.
I'm pharmacist Abubakar Jubril. I'm physiotherapist Saint Jenny.
So today in the studio we have doctors, pharmacists and physiotherapists to help us elaborate on what peptic ulcer really is. Today we'll be talking about this peptic ulcer, and I'll start with some questions. So, Habib, can you tell us, what are these peptic ulcers and what are the types of peptic ulcers?
Thank you very much, Juliana. An ulcer basically is like a wound in any part of the body. And peptic ulcer, by that definition, is a wound in the stomach and the intestine, using the renal stem. And there are different types of peptic ulcer disease. The common ones we have are the gastric and the intestinal or the duodenal, which occurs commonly in the duodenal. The duodenal ulcer is the commonest one, even though both the gastric and the duodenal ulcers present in similar fashion. There may be some slight differences. And it's worth noting that there are other diseases, other conditions that present with similar symptoms and signs that the peptic ulcer disease is present with.
Okay, so are you trying to tell us that peptic ulcer is not a hard burn, it's actually an open wound?
Yes, it's an open wound. Just think of a wound on any part of your body. It's also do something similar in that manner. And that also explains why we get that kind of sensation, as my colleagues will talk about later on, with regards to how the symptoms present and what triggers those symptoms.
Okay, you talked about ulcer, but you didn't tell us if there are other types of ulcer.
Yes, there are other types of ulcers. There are the pressure ulcers, the ones that occur due to vascular problems, diabetic foot ulcers, but those are not within the scope of what we are discussing, since today we're talking about only peptic ulcers. Others cause due to pressure on some parts of the body and other forms of injuries as well.
Okay, so talking about this peptic ulcer, can you actually categorize? I'm sure peptic ulcer has types. Can you categorize it to its types?
Yeah, the major types we have, we mentioned earlier, the gastric and then the duodenal types. Okay. And then also there are also different causes, but I think my colleagues will talk on that.
We would like to explain to us, elaborate on the gastric ulcer so that we know how does gastric ulcer feel, how are the signs and symptoms?
Okay, the gastric ulcer and the duodenal ulcer, collectively called peptic ulcer, they present similar. Usually they come with what people describe as heartburn or chest pain in some. Medically we call it epigastric pain, which is like a burning sensation. For some people that gets to the back and then it's related to food, whether they eat food or some whether they do not eat food, also the kinds of food they eat, and also some other strenuous activities as well.
So, Jibrin, can you tell us, talking about these ulcers, can you also elaborate on the abdominal ulcer?
Okay, just like my colleague said, when we talk about peptic ulcer disease, generally it can be the gastric ulcer, and then the gastric ulcer is basically the one that is in the stomach. Then the duodenal ulcer is the one that is at the small intestine. The duodenum is actually a part of the small intestine, which is actually the first part. So when you have an injury in the duodenum, that's basically what is categorized as duodenal ulcer.
Okay, thank you. Hamza, can you tell us what causes these ulcers and who, or which people are mostly at risk of getting this type of peptic ulcers?
Basically, most of the ulcers, let's say more than 70% of the ulcer is being caused by a bacterium known as Helicobacter pylori, H. pylori in short. this bacterium is ingested through oral route, and it affected the lining of the stomach. This protective lining of the stomach, with time, it gets eroded by the bacterium. It then exposes the wall, which is in a stomach wall, to the gastric acid. From there, it causes wound. This is the first cause of the peptic ulcer.
Can you bring it down to our understanding? You know, our audience, and even me, I'm even confused because it's not our field. So,
okay. When this Helicobacter pylori enters the stomach, it attaches to the wall of the stomach.
Okay.
There is a protective covering in the surface of the stomach. It is mucosal in nature.
Okay.
It eats up that mucus. Later, it then exposes the lining of the stomach to the gastric acid. You know, acid is generally corrosive. With time, it then destroys the epithelial lining of the stomach. That is the tissue there, the skin in layman's term. Then it forms a wound. From there, whenever this gastric acid touches the wound, it causes a burning sensation and a pain. The number 2 cause of this peptic ulcer disease is the use of non-steroidal anti-inflammatory drugs.
okay.
All these cataflam, ibuprofen, real extra, some people call it Chiotekos, and their likes.
Wow.
They have the ability to destroy this protective layer of the stomach, thereby exposing the stomach to the gastric acid.
Okay, so Hamza, you're trying to tell us that people that take ibuprofen, like painkillers, because I know a lot of people that whenever they are stressed or tired, they just tend to like, okay, let me just go and buy painkillers and take. So they are exposing themselves to this peptic ulcer, and then many people are not aware of this.
Yes, that is because they take this medication without prescription, and it has become their habit. You know, generally these all painkillers, they contain certain less chemicals, the caffeines. So this caffeine is the one responsible in destroying the layer in the skin, in the stomach.
Okay.
Yes.
Wow. I think this is an awareness for our audience who often misuse these drugs as a form of, they are trying to ease another pain, not knowing that they are causing another pain to themselves. So this is an awareness for people to know that that ibuprofen you keep taking all the time, that caterpillar and other drugs actually is the cause of that ulcer. So Hamza, can you also tell us how does the signs of this ulcer, how do they present themselves? How do you know that you have ulcer?
The most common symptom is heartburn, which occurs as a result of acid reflux into the esophagus. This is a term that best describes when the gastric acid escapes into the esophagus. Like it goes up there, then it causes a burning sensation in the heart or in the chest. Esophagus, like it goes towards the throat there.
Just like a pipe.
Okay. Okay.
Yes.
Okay.
Well,
All right. So carry on.
then the second symptom is there's a bloating. This is mostly associated with gastric ulcer.
Okay.
It's a like stomach fullness like feeling that occurs as a result of trapping of gas in the small intestine, the upper part of the small intestine, the duodenum.
Okay, so heartburn really is a symptom of ulcer, but
Yes.
not limited to only ulcer.
Yes.
Okay. All right. So Fatima, Dr. Fatima, can you tell us how is peptic ulcer diagnosed?
Okay, peptic ulcer is usually diagnosed based on the clinical features plus some specific investigations. As Hamza already stated, patients may present with episodic burning epigastric pain or heartburn, usually 2 to 5 hours after meal or on an empty stomach, which is aggravated by hunger and relieved by taking food or antacid.
Okay.
So when a patient presents with these symptoms, suggestive of peptic ulcer disease, we need to undergo some investigation to confirm our diagnosis.
Okay.
So in this case, we have 2 major investigations. We have what we call the endoscopy and the H. pylori test.
Okay.
For this endoscopy, it entails using like the camera to visualize the stomach, the esophagus, and the small part of the intestine, that is the upper part of the duodenum, in order to localize, to see where the ulcer is, the number of ulcers, and even the severity of the ulcer. Then the second one is the H. pylori test. We know this H. pylori, this bacteria, is account for almost 85% of peptic ulcer cases. In order to confirm our diagnosis, we want to test for the presence of that bacteria. So we can either use the stool, we can use the blood, that is the serum, and we can also use the serum, the urea breath test is also used. So we can, depending on your patient presentation and the age, you can decide which of this investigation are you going to carry.
You know, I'm actually seeing the essence of this discussion because many times I was not even aware that there is this long procedure for diagnosing somebody with ulcer, because many times people tend to just, my heart is burning, let me just go and buy omeprazole. My heart is burning, let me go and buy ulcer drug. You understand? They just diagnose themselves. They just conclude that it's not knowing that there's this long procedure that needs to actually, somebody who needs to go through.
Okay, that is the usual mentality when you have chest pain or gastric pain, you just conclude it's ulcer. But ulcer, or peptic ulcer in general, is not the only cause of epigastric pain. We have other causes. Maybe in the elderly, the patient might come and present with epigastric pain or chest pain, not knowing that the patient is having issue pertaining to the heart. And some people might mistake it for ulcer, and the patient will be wrongly treated.
Yes.
And long last,
especially those that do self-medication.
Yes. So when you have an epigastric pain, you have to consult your doctor so that we can confirm the diagnosis using your clinical presentation and to undergo the non-invasive, that is the H. pylori, before going for the endoscopy, which is more kind of
Okay, so Dr. Fatima, can you tell us how is this peptic ulcer treated or managed?
Okay, depending on, peptic ulcer can be managed in so many different ways. We have the pharmacological and the non-pharmacological ways to manage peptic ulcers. For the non-pharmacological ways, we have the lifestyle modification. That means, as we know, peptic ulcer is caused by NSAID use, chronic use, and also H. pylori. So in this case, we know this H. pylori is, how do we get in contact with H. pylori? It's through the fecal-oral or oral contact.
You're so just throwing grammar. You're using medical terms, and most of us are... Yes, you know, we need to understand what we're saying.
Usually this bacteria gets into the body through injection of contaminated food or water. So when you ingest this food, the bacteria go and stay in the lining of the stomach, the duodenum, and cause all those disruptions. So in this case, personal hygiene is one of the major ways to prevent this bacteria. And also you have to stop taking those NSAID without prescription from a medical doctor, because you are causing more harm than good to yourself.
Thank you very much. So I think I'll move on to Pharmacist Jibril. Can you tell us, how is this peptic ulcer, when it's not properly treated or managed, what happens?
When you talk about what that, I think you are basically talking about the complication. You know, so a lot of complications can happen when these ulcers are not properly managed. You know, when my other colleagues were talking, they basically explained to us how these ulcers are just an injury on the surface of the stomach. So when these injuries are not properly treated, there is a chance that they continue to worsen. You understand? So, and then when this happens, that you can have, like, you can end up having like perforations. You know, perforations are just basically like holes in the surface of the stomach. So when these injuries are not properly managed, you know, constant exposure, you know, my colleagues have been mentioning acids and stomach. I'm sure for a layman it's a kind of contradictory thing, but the truth is that you actually have acids in the stomach. You know, those acids, their function is actually to help in digestion and other function in the stomach. But then when there is a kind of problem, they can be a problem. They can lead to this ulcer. So when this acid are constantly exposed to this wounds, they can continue to make a hole in that wound, and that can lead to perforations. It's also known that when you have injury, sometimes it can cause bleeding. So in some very chronic cases of ulcer, a patient can come up with they can vomit blood. That happens in very chronic cases. And then in some instances, they don't vomit it, but then they pass it as excreta. So a very characteristic feature you notice when a patient is passing this blood as feces is that it will be dark. You understand? The feces will be dark in color. So that's an indication that there is a bleeding from the stomach. You understand? And another thing we also don't know that is when ulcer is not properly managed for a very long time, it can lead to cancers. You understand? That happens, yeah. So that's really why it's important to make sure that we get proper treatment.
I think this is a call for action for anyone that is experiencing these symptoms to actually go for medical checkup in order not to make sure that it doesn't get worse or cause stuff like ulcer, like cancer that you said. So Jibrin, can you tell us what are those preventive measures that we can actually put in place to actually see that we don't get this ulcer? And then in terms of people that have it, what are those preventive measures that can actually put in place in order not to that you said is an open wound, so that not to make the wound like spread or something?
So just as Dr. Fatima said earlier, when we talk about managing the ulcer, it basically means putting measures in place. For those that don't have it, you put measures in place so that you don't have it. And then for those that already have it, you make sure you adhere to a set of instructions that will prevent this ulcer from getting worse. And then even after you've undergone treatment, there's a chance that it might come back. So you basically try to avoid this. So to be specific, in the preventive measures, my colleagues have mentioned how there are some specific things that cause ulcer. So if you want to prevent them, you just avoid it. You understand that? They spoke about NSAID use. NSAID are basically drugs that are used as painkillers. So we are not saying that whenever you take NSAID, you are going to come down with ulcer. The problem is when these drugs are taken for a very long period of time. You understand? That's why it's very important that you consult professionals. So avoid taking this drug for a very extended period of time. And then when you have the need, when you have the pains, you consult the right professionals. You understand? So that's one. And then another thing is that lifestyle habits like alcohol, taking alcohol and smoking, they also have the ability to destroy this protective lining we say they have in the stomach. So when this lining is destroyed, it can cause ulcer. So a key way to prevent ulcer is to do away with this taking all this alcohol and smoking. And then there are also a set of drinks, the one we call energy drinks. Just like my colleague Amza mentioned, these drinks are usually very high in caffeine. So what caffeine does in the body is that it increases the production of this acid in the body. Normally you have a level that is good enough for the body, but then this caffeine, they kind of trigger release of more of it, and then when you have more, that's when it causes ulcer. So a key way to prevent this is that we should not abuse these energy drinks or other things that have caffeine generally.
When Hamza was talking, he made mention of anti-inflammatory drugs such as caterpillar, ibuprofen. But there are circumstances where those drugs are necessary for you to take. So is there a substitute drugs that you advise our viewers to take instead of those particular drugs that will substitute it, that will not actually increase the acid or cause the ulcer to get moved?
Okay. Before that, I want to, just like I said, I want us to be clear. We are not saying that any person that takes this NSAID drug would automatically come down with ulcer. What is a problem is when these drugs are taken for an extended period of time. You understand? Yeah. NSAID, specific example, all diclofenac, ibuprofen, pyroxicam, all of them. In fact, I've seen instances where people even combine these drugs. You understand? When something that you should take one will be a problem and you are combining it, you are basically multiplying your problems. So not abusing these drugs is one way to, but among the NSAIDs too, it's not all of them that cause cause this ulcer. You know, like your normal paracetamol. Now, even though when people have pain, they tend to disregard paracetamol as ordinary, but it's a very effective. You must not always go to the level of taking. So you can take your paracetamol. Among the NSAID, there are specific ones like that don't cause this ulcer. A specific example is what they call celecoxib. You understand? You know, there is a specific way this one's cause ulcer. Those other ones. So this one it doesn't. So celecoxib it doesn't cause ulcer. And then there is also meloxicam. You understand? It also don't cause ulcer as much as the other. Okay, this is not an endorsement for us to go and buy this drug. You know, just like prescription.
We're just creating awareness. Okay, so Dr. Habib, I will come to you. So can you tell us, you know, talking about misconceptions about hunger, can you tell us something about that misconception that hunger actually causes ulcer? Can you add more light to it?
Okay, hunger doesn't cause ulcer.
Okay.
What it does is it makes the symptoms of a person that really has the ulcer can worsen the symptoms, can trigger it, because when the stomach constantly produces the acid, so if a person has not eaten for a long period of time and then the acid is being produced, it irritates the wound that had already existed prior to that. So, but it does not cause ulcer. If a person does not have the peptic ulcer disease at initial, it will not cause it. It only worsens it.
So I think this is a note for our viewers that hunger does not cause ulcer, but if you already have ulcer, it actually can increase it. Sunny, you've been quiet. So I would like you to touch on a particular misconception that maybe pepper. You understand? When you tell people that, some people be like, I have ulcer, then the next question that comes, are you someone that takes too much pepper? So does pepper actually increase ulcer?
Yes, you can say that it can worsen the symptoms, because for someone that has a wound and you take pepper,
like an open
think of it as if you have open wound on your skin and you put pepper, what will happen?
It will be painful.
So that's what pepper does.
Okay.
So mostly it worsens the symptoms, not directly cause cancer. That's what happens. Yes, it does. Yes.
I think I have a lot of misconception. I would like each and every one of us to say something about it. Hamza, can you tell us about there? I think I heard people talking about hot food. That when you have ulcer, you shouldn't take hot food. I don't know. Can you tell us, is that medically true?
I don't think so. Because you know, normally when one has ulcer, already has ulcer, you know, as I said, ulcer is a wound in the stomach. So after taking hot food, what will you expect on the wound? It will irritate the wound, and from there the wound will worsen. So that is what basically happens. But
it doesn't cause it, but when you already have it, it's like can irritate it and make you feel some certain sensation.
Yes.
Okay. All right. So, okay, you want to add something?
Yeah, just to add to that, I think pepper food doesn't cause ulcer. You know, just okay, I'm eating pepper. It doesn't mean somebody will automatically come down with ulcer. And then just the hot food you said, it doesn't mean that when you eat food, hot food, you automatically come down with ulcer. But then for someone that already have this ulcer, doing those things can worsen the symptom. Another misconception is people believe when you take fatty foods that have a lot of oil, that it's, you know,
and sour food.
Yeah. So like sour food now, it can cause that irritation we are talking about, and then that will worsen for someone that already have the ulcer. And then for fatty food, what happens with fatty food is that, you know, there is a period of time that it takes the food to pass through the stomach. So for fatty food, they kind of prolong this period. You understand? We call it gastric emptying. So when this process is prolonged, you know, this acid that are meant to be digesting the food, that means they are released for a very long period of time, and that's what causes that symptom. So basically, sour food, peppery food, hot food, it doesn't outrightly cause ulcer, but then when someone has the ulcer, it can worsen the symptom.
I think we really need to settle these misconceptions. I have another one. So talking about milk, often at times you see people advising others like ulcer patients, that when you feel a burning sensation in your heart, go and take milk. But I was reading somewhere and I came to the realization that milk can only subside the pain for a certain period of time, but later it can actually increase the acid. Can you tell us more about it?
Okay. I think the thing with milk, just like you said, you are basically prolonging your suffering, but you eventually come. I don't know if I can put it that way. So when you talk about milk subsiding ulcer, I think you can give a yes and no answer to that. First, when milk is taken, at that moment in time, it will help to subside the symptom, because you know milk is very thick, so it forms a kind of coating on those injuries. So at that time, the symptom will seem like it has gone down. But when this milk is getting digested in the body, it has the ability to cause the release of other substances like these acids we are talking about, this gastric acid. So at that point, when this digestion is occurring, the symptoms are going to be worsened. You understand?
You know, this milk, I have seen a lot of people that use it as a remedy to subside ulcer. And when there is no drug, they will be like, okay, take milk as a remedy. So they don't really know that what they're doing is actually implicating their health and actually making it worse. So I think this discussion is really creating awareness to our audience.
To add a little more about this milk, there are some traditional herbalists that are even giving some concoction and will ask you to mix it with milk and take as a remedy for us. So I think this will only worsen the situation.
Wow. We didn't even talk about traditional and other stuff.
I've seen so many cases in which somebody will be given some concoction and you'll be asked to mix it with milk as remedy for us.
It is well. Fatima, you wanted to add something?
I want to add something. Some people think that all peptic ulcer cannot be cured. That means if you have ulcer, you have ulcer for your long life, which is a lie. Peptic ulcer can be cured if managed properly by a specialist. The only thing is that it can reoccur if those measures are not taken into consideration. So when you want to cure your ulcer, you have to follow the protocol.
You have to be dedicated.
Yes. Because we have some medications that we are going to prescribe for you. You have to take them how they are being prescribed so that we can heal that ulcer.
Okay. Fatima, I want to add up to something. You know, when you talked about the fact that you have to be diligent for ulcer to actually heal, you know, there are actually other food items that we didn't talk about that can also increase ulcer. Like I was reading somewhere and it talked about tomatoes, vinegar, orange. So okay, is there like a particular advice that you give our audience? Okay, when you're actually treating ulcer, there are also certain types of food that you should avoid.
Yeah, as a form of advice, when you're treating ulcer, we know there's the tomato, the vinegar, they are all kind of triggers for the peptic ulcer pain. So when you have peptic ulcer, you have to avoid all these triggers. Understand? In order to make the healing process more faster.
Yeah, so that it will not be like you're taking the drug, but you're actually doing the contrary.
Yes. So you have to like stop it for some time, maybe after the healing process.
Thank you very much. So Sani, I will come to you. So let's talk about, you know, fasting is fast approaching. Ramadan is coming, and we also have our Christian brothers who are going to engage in Lent season. So what advice would you give our brothers and sisters out there who are actually planning to engage into this fasting but are actually ulcer patients? How would they be able to manage the fasting and also manage their ulcer?
Well, normally during fasting, an individual will take food in the beginning of the day, and after a long period of time, then we break the fasting. So it is important that somebody take food before starting the fasting. Is very important, because some people will say that there is no need for them to take. Yes, it's good to eat before starting the fasting.
So that the hunger.
Yes, and it's also good to avoid this type of foods that you mentioned that loosening the ulcer symptoms. It's good to avoid them during what we call sahur. That is eating food before starting the fasting. It's very good, and it's good to take all these precautions that were mentioned. It's very good. And another important thing is, I think
for people that are smoking, it is very addictive. Sometimes immediately after breaking the fast, somebody will start with smoking. Wow. So because of the addiction, it's because of the addiction. These things are very addictive. So it's good to avoid such problems. Yes.
Okay. All right. Thank you very much. Okay.
Another thing is that during breaking of the fast, I advise that people should start with something light. Let's say water, dates, or anything that is very light, so that the stomach will become adaptive. It will adapt to the situation before taking heavy meal.
People will tell you that they want to open the stomach.
That is it. Because if you go on with heavy meal, it will lead to indigestion and so on. And also, one should avoid all these carbonated drinks, energy drinks, and their likes, because the drinks themselves are highly acidic in nature. And when one is having ulcer, it's just like adding another acid on top of the wound from external source.
And I've seen people that break their fast with Coke.
Yes, there are. And it contains caffeine, so it also has the ability to even cause cancer, cause the ulcer itself, because it has the ability to destroy the protective layer of the stomach.
Another important thing, especially about using that painkillers for people that are having musculoskeletal pain. Mostly somebody will come complaining of low back pain, knee pain. So that pain is leading them to be taking those painkillers. So more especially for people that are having back pain. This ulcer pain can be referred to back. And sometimes, yes, it's very possible the pain is not. It's not because of the pain is in the. It's not in the back. It's referred from and you are taking these painkillers. So you are worsening the condition. So most of the times you see people having ulcer, complaining of back pain, and they keep on taking these drugs without prescription. So
continue, but due to time, I think we'll just talk about the last question, which I will direct to Sani. Can you tell us if there are other types of ulcers? Is it only peptic ulcer that we have, or are there other types of ulcer that people are not aware?
Just as Dr. Sadiq mentioned, that ulcer is just wound. It can be in any part of the body.
Okay, not necessarily.
Yes, not necessarily. Yes, it can be any part of the body. There are some common examples like pressure ulcer, the one that happens to people that are bedridden, that are lying on the bed. Yes, bed sore. Yeah, we call it bed sore. It happens mostly to patients that are immobilized for a long time, and that is why we are taking precautions in the hospital of positioning 2 hourly, and normally the nurses change position in the patient to avoid that, because it is as a result of pressure and weight. Maybe the skin is wet and there is sustained pressure, there is lack of blood circulation around the region that predisposes the skin to have that wound. It's very common, and if care is not taken, it can be infected, because it is mostly happening in hospital settings, and that's very serious. And apart from that, there is also venous leg ulcer, which happens as a result of as a result of insufficiency of the blood vessels to pump the blood off back to the heart. It's also very common. The signs of which are swelling, you see swelling, and there is pain too. There is another one that is very common to diabetic patients.
Oh my goodness, what is your therapy? We are really out of time to allow you to continue. But now I've come to the realization, and I think we really need to do more of this kind of discussion. So I think on our next episode we'll talk about other types of this also. I think we'll speak another topic, and then we'll actually invite you people to come and elaborate on it. Thank you very much for your time. Okay, viewers, we've come to the end of today's program, and I would like to inform you that we've not ended the program entirely. It's just this episode, and we'd love to see you here next time, same venue. So I remain Juliana Kayos Brema, and I have with me in the studio
Dr. Sadiq Muhammad,
Ms. Muhammad Hamza,
Dr. Fatima Bafa,
Pharmacist Abubakar Jibril, Physiotherapist Santi Jenny.
Thank you all for watching.
Thank you.
Thank you.
The NYC anthem at the count of 2, 1, 2.